My name is Chen. I'm Associate Professor from the Department of Health Services Research and Administration, College of Public Health at the University of Nebraska Medical Center. And I have my colleagues join me on the call today. I'm going to mention about them later. Today, we want to talk about the assessment of workforce capacity for local health departments in Nebraska from a perspective of public health topical area. And first, I would like to acknowledge my colleagues. Ms. Ann Wen, she is a data analyst and also a Ph.D. student from my department. And Ms. Janelle Jacobson is also a Ph.D. student and a graduate assistant from my department as well. And Dr. Dave Palm, he is the administrator for the Office of Community Health and Performance Management from Nebraska Department of Health and Human Services. Both Dave and I are the co-PIs for Nebraska Public Health PBRN. And all of us are on the call today, and so they can also help answer some of the questions you may have during the for the presentation today. And I also want to thank the steering committee of Nebraska Public Health PBRN for their contribution to the design and implementation of the study. And of course, this study was funded by the Robert Wood Johnson Foundation. Let me first give you some background about Nebraska's public health systems. Prior to 2001, local health departments only cover 22 of the state's 93 counties. So in 2001, Nebraska legislature passed Nebraska Healthcare Funding Act to build a public health infrastructure across the state. So since then, 17 regional local health departments have been developed. So now every county in Nebraska is served by a local health department, either a single county health department or a newly developed regional multi-county local health department. This map shows the county composition of the 21 local health departments in Nebraska. Again, among these 21 local health departments, 17 are regional departments that cover multiple counties, and 4 are single county local health departments. And the size of regional departments ranges from 2 to 10 counties. Empirical studies suggested that workforce capacity and characteristics are associated with the performance of public health agency and system. However, as Dr. Mays suggested in his earlier article, the current evidence about public health workforce is not adequate to support the recommendations about the optimal level and composition of staff required by public health systems. And so currently, nature profile of local health departments is the only national source for public health workforce data at the local health department level. The nature profile collects workforce data by occupation type. This table shows the types of occupations included in the nature profile survey. So they include the occupations such as public health managers, public health nurse, physician, environmental health worker, epidemiologist, health educator, and so on. However, previous studies suggested that about 25% of LHD staff are actually in occupations that are not listed in the nature profiles occupation table. So in order to capture a more complete picture of LHD workforce in Nebraska, we conducted a workforce study from the perspective of public health topical area. So by working together with the steering committee of Nebraska Public Health PBRN, we proposed a new approach to categorize the LHD workforce by public health topical areas. And these are the public health topical areas we identify. They are the typical public health issues addressed by a local health department. They include things like STD, communicable disease, family health, mental health, oral health, risky substance use behaviors, primary and other direct health services, occupational health, and so on. So in 2010, we conducted a mail survey of local health department directors in Nebraska. And through the survey, we collected information on LHD workforce capacity, as well as their staff training and competency by the identified public health topical area I just mentioned. We also collected information on the challenges associated with the development of LHD workforce. A total of 19 directors completed and returned their survey to us. So this resulted in a 91% response rate. Due to the small sample size, so we focus on descriptive analysis. Nevertheless, we think our survey did provide some new information beyond the natural profile data. Our survey collected the information on LHD current FTE as well as additional FTE needed by public health topical area. And using this formula on the slide, we created and calculated a shortage index score for each local health department in each public health area. Correlation analysis was also conducted to explore the relationships among key variables. So results. So this slide shows the general staffing level for local health departments in Nebraska. As you can see, the median number of employees per LHD increased from 9 in 2008 to 10 in 2010. And the median FTE per LHD also increased from 8 in 2008 to 9.6 in 2010. On the other hand, the median number and percentage of associated with full-time employees remained the same during this period. Although Nebraska local health departments experienced a slight increase in their staffing level from 2008 to 2010, their perceived capacity to handle workload has declined during this period. So the percent of local health departments that reported having enough staff to handle their workload has declined from 25% to about 12% of the responding departments. This slide shows the percentage of local health departments that reported having staff dedicated to cover the various public health areas. If we look at the purple bars on the right-hand side, about 67% of the responding local health departments in Nebraska reported not having any staff to cover the area of mental health. And that was followed by 44% for STD, 39% for occupational health, and about 28% for oral health. And if we look at the left-hand side of the slide, and 100% of the responding local health departments reported that they have staff to cover the areas of communicable disease, food safety, and indoor air quality, emergency response, and community planning. And this slide shows the median current FTE of local health departments by public health area. The median values range from 0.13 to 1.38 FTE. And Nebraska local health departments had the lowest median FTE in the areas such as oral health, STD, occupational health, and mental health. So for the purpose of comparison, this slide shows the median current FTE of local health departments by occupation type, using data from the 2010 Nature Profile survey. So the occupations with the highest median FTE include public health nurse, health educator, and public health managers. This is just for the comparison purpose. Now back to our survey. So this slide shows the median values of the additional FTE needed by local health department by public health area. The median values range from 0.5 to 1 FTE. And this slide shows the mean LHD shortage score by public health area. So in terms of the average shortage, environmental health, chronic disease, and health disparities were ranked as the top 3 areas. And Nebraska local health department had the lowest average shortage in the area of emergency response. For each local health department, we also calculated an average shortage score of all public health areas. And then our correlation analysis indicate that LHD's capacity to handle workload was negatively associated with its average shortage score, although the statistical significance here is marginal. This slide shows the median ratings of directors' satisfaction with their staff's training and education on a scale of 1 to 5. In general, the local health department directors in Nebraska were more satisfied in the areas such as food safety and indoor air quality, emergency response, healthy lifestyles, chronic disease, primary and direct health services, family health, and communicable disease. And this table, this graph shows the median ratings of directors' satisfaction with their staff's competency and skill. Again, on a scale of 1 to 5, and by public health topical area. In general, the directors were more satisfied in the same areas as those mentioned in the previous slide. And this shows the self-assessed capacity of local health departments to carry out the 10 essential public health services. The majority of local health departments had either high or full capacity in the services such as educating the public and linking people to needed services. And the lowest capacity was observed in the services such as research. And this shows LHD's role in carrying out the 10 essential public health services. In general, the majority of local health departments provide their services jointly with their community partners, with higher percentage of local health departments taking the lead in the essential services such as monitoring health status, educating public, and mobilizing community partnerships. We also do correlation analysis between staff training competency and the LHD's capacity. So this correlation, this table shows that directors' average satisfaction with their staff's formal training and education was positively associated with LHD's capacity to carry out 4 of the 10 essential services. And this includes monitoring health status, the development of policies and plans, assurance of health workforce, and evaluation of effectiveness, accessibility, and quality. So we also did a similar analysis focusing on staff competency and skill. Our analysis indicates that directors' satisfaction with their staff competency and skill was positively associated with LHD's capacity to carry out 6 of the 10 essential services. And this includes monitoring health status, investigation of health problems, development of policies and plans, linking people to needed services, assurance of workforce, and again, evaluation. And our survey also indicates that about 40% of the responding local health departments did not develop any agency plan for staff development and growth. And similarly, about 40% of local health departments did not develop professional goals and plan for their individual staff member. And we also, in our survey, we also asked our directors to identify the challenges associated with the development of their workforce. So the top challenge that was identified was the instability of funding, and that was followed by inadequate pool of qualified personnel in the region and the limited public health experience among workforce. So based on our director's survey, we concluded that using public health topical area approach, LHD's capacity to handle workload is negatively associated with its average shortage score of the all public health topical areas. And also, the LHD's capacity to carry out essential services is positively associated with their staff training, education, as well as competency and skill. And again, this is based on the public health topical area approach and measures. So our research suggests that public health topical area approach may provide useful information to capture some gap of local health department workforce data. However, because this is based on small sample size and bivariate analysis, so future research using a larger sample should be conducted to examine the validity and reliability of the workforce measures based on public health topical areas. And I also want to just briefly talk about the result from our LHD staff survey that are relevant to this presentation today. In 2010, we also conducted a survey to local health department staff in Nebraska, and a response rate of 32% was achieved. I just want to show you two graphs that kind of relevant to the topic I'm talking about today. So we asked the local health department staff to identify the public health issues they address and cover in their daily work. As you can see in the slide at the bottom, 2.7% of the staff, the responding staff, selected other as one category. And this is based on, again, our public health topical area approach. For comparison purpose, we also use Nature Profiles occupation table and ask the local health department staff to identify the occupations they belong to. And as you can see, other category now become at the top. So about 29% of the responding staff actually identify other as one of the categories. So again, this is kind of consistent with the profile study that shows that about 25% of local health department staff are actually in occupations that are not listed in the occupational table. Okay, I think that's it for my presentation. Again, I mean, if you have questions, please, you're welcome to ask the questions, and all of us can answer your questions.
Fantastic. Thank you so much, Li-Wu. This is really great, great work, and I think we're learning a lot through the work you guys are doing in Nebraska on this very important topic of public health workforce. So we do have some time for questions for Li-Wu and his colleagues in the Nebraska PBRN. Let me suggest that we use the technology a little bit just to manage. If you've got a question you want to ask, we do have a large group on the on the call today, and if you're on the WebEx account, the web-based interface, could you hit the little button that looks like a hand to raise your hand? That way we can call on you individually. That way we can manage the questions a little bit better, perhaps that way. If you're only on the phone, you can speak up if you got a question if you don't have access to a little hand raising tool. But for those of us on the web, if you could use that, if you just raise your hand if you got a question for Liwu, that will help us manage things a little bit better on the Q&A front. So while you all are thinking of your questions, maybe I'll throw out a first one, and that is since Nebraska, you guys are kind of on the cutting edge with respect to looking at regional service delivery and with the work that's been done to develop the regional health departments. I wonder if you've done any work with your data to look at evidence of differences in capacity or shortage, or differences in some of these correlations between the regional health departments and the single county health departments in Nebraska. Recognizing you've got a limited sample size, so probably you can't support a lot of statistical inference about differences, but just looking even qualitatively whether you're seeing some patterns there with respect to differences in workforce capacity between the regional models and the single county models in Nebraska.
Mm-hmm. Thank you, Glenn. This is a very good question. As you said, because the small sample size, and we do try to break our sample down to regional versus single county, because only 19 local health departments respond to the survey. So only got 2 single county local health departments in the sample. So that analysis, I mean, as you can expect, didn't show any difference between just looking at the regional sample and the whole sample. But as far as qualitative information, I think Dave can also comment on that, because in many of our regional public health jurisdiction, they contain some number of rural counties, and in some cases, quite some frontier counties. So like the areas such as mental health, that's really kind of significant, because like 89 counties out of Nebraska's 93 counties are designated as federal shortage area in mental health professional. So this kind of professional area is probably more an issue for the regional local health department, which contain rural communities. Dave, you want to?
Yeah. Yeah, this is Dave Palm. I was going to say, too, of course, where we have our two largest by far single county health departments are in Lincoln and Omaha metro areas. And there are many of our other single county health departments are quite small. So, of course, that's one of the reasons why we went to regional departments, is that we knew we couldn't support a lot of single county, very small health departments. But I think that's one of the things we have to continue to look at, is what are those differences, and how. And I think another question is, how have the regional departments really helped us to improve capacity? We haven't seen, for example, we would like to see an environmentalist or an epidemiologist really shared between regional health departments. And so far, we haven't seen that to any great extent. So I think we have to also look at other issues in terms of building capacity for our regional departments, and as well as some of our very small single county departments.
Excellent. Thank you, Dave. That's very, very interesting work. Other questions? I'm not seeing any hands raising from the field. Anybody on the phone or that has a question to pose for our colleagues in Nebraska?
Glenn, hi, it's Elaine. I'm sorry, I'm trying to press on the hand icon, but it's not working.
Maybe it's disabled. Well, go right ahead, Elaine.
Okay, I'm sorry I came on toward the end of the presentation. Something that this is just a clarification. I was so interested in that last slide where you see the largest proportion of workers are categorized as other.
You mean 28%? Yeah.
Was that broken out in any way? Who are they? Are they people that could be performing other functions? That could be, doing other jobs, so it would address some of the capacity issues? I mean, who fits into that?
Yes. Actually, I think some of the other occupations they identify include such as, for example, like people who can do data analysis, statistical analysis, and maybe also do some more case management, or those for chronic disease, those kind of occupations. So I mean, there are some, and also like something like GIS specialists, those kind of things people do identify.
Thank you.
Sure. Yeah.
I see we got a question from Paul Irwin next. Paul, go right ahead.
Yeah, thanks, Glenn, and thanks again for the presentation. Very nicely done. Just a sort of a methodological question. Was the respondent to the survey the same person who would have responded about capacity for providing the essential services as the response to the questions about satisfaction in terms of the level of training?
Yes. Yes.
I mean, is there any, I'm not sure what the right term is, whether it's dependent error or autocorrelation. Is there any concern about that?
Yes, I think this is a good question, because, I mean, there could be some kind of correlation between their response to these two different questions. So we actually we think a future study based on a larger sample size, so that that should be done, so that we can apply some kind of methodology to correct this correlation, and maybe more objective measures for the local health department's capacity can be used to replace the self-reported capacity by directors. I think that would probably remedy for some of the problems.
Okay.
Thank you
very much.
Thank you. Yeah.
Other questions for Li Wu and colleagues in Nebraska? Let's see.
This is Bill Livingood. I was just.
Oh, hey, go right ahead.
I just posted a quick question about: was there any effort to assess the different education or training levels, like technical certificates, or 2-year degrees, or bachelor's degrees, or graduate degrees, anything like that, in terms of the level of education and training that was you were surveying the participants for?
Yes, we actually, in our staff survey, we did collect that information, but we just didn't report that in the presentation today. And because we did ask our the responding staff about their education level, and I mean, in terms of what kind of educational attainment they have achieved, those kind of things.
Did you see if that influenced your results? Did that impact your results, or did you analyze that within the context of your results at all?
No, that's a good question. We have not had a chance to compare that the staff result to this director survey result.
But that's probably something we need to follow up on. That's a good suggestion.
Yes, yeah, totally agree.
Good questions. back on a kind of a methodological bit, it strikes me that your survey, in terms of measuring these FTs in these different categorical areas, it strikes me that the NATO profile survey also includes some similar questions, and there's always been concerns about the kind of the validity and reliability of the workforce FT data that is collected through NATO, in part because there's a lot of non-response, and you know, and sometimes things don't add up. So if you haven't already, it might be very interesting to kind of, just from a purely validation standpoint, to look at the correspondence between the data you collected through your survey and the workforce FTE related data that is captured from NATO profile, to see what the correspondence is, and perhaps to see whether, you know, if there's some differences, whether you know, whether your survey might suggest some better ways of capturing, or more reliable ways of capturing some of the staffing and staffing capacity data. Have you thought about doing some comparative work with the NATO profile?
Yes, I think this is a very good suggestion. We thought about that, something that can be done in a future study. Of course, need to be on a larger sample size. I mean, because the small sample size in Nebraska, we cannot do that. But if we can collect the FTE information of local health departments using public health topical area approach, and again, collect that information from a larger sample of local health departments, and then compare that data with the occupation type FTE data from the nature profile, and maybe using some kind of methodology to assess the correlation between occupation type FTE and public health area type FTE, and to see whether using this public health topical area approach can really capture some gap of the occupation type FTE from the nature profile. I think that's something that should be can be done and based on a larger sample size. I think, yeah.
Fantastic, excellent. So I think we've got a question from Tracy. Go ahead.
Yes, thank you. Hi, Glenn. Can you hear me okay?
Yes. Yeah.
Great. Thanks. This was a great presentation. I really enjoyed it. And it has me thinking about the project that I'll be launching now here in Washington State, looking at capacity to address health disparities in our local health departments. And I'm wondering, I noticed, maybe we could go back to the slide where you mentioned that there were 3 top areas, and I know health disparities is one of those. There we go. And I'm just wondering, between that and then the information that you had about the leaders' satisfaction with ability to address those areas, if you had any thoughts about why that might be and how that relates to these top 3 areas.
I think. I'm sorry. There's an echo. Here, coming here.
Yeah, we got a little echo. If folks wouldn't mind muting their lines, so we can maybe address that.
Okay, thank you. And this is a very good question. We did not further assess that relationship, but I think the shortage score reflects the director's self-assessed shortage in terms of public health area. And so it's more like what they think, in which area they may need additional FTE to cover their responsibility, and if so, how many. And but their perception about the staff training, education, and competency, I mean, it seems that because it's kind of interesting. We found that their perceived satisfaction with staff training and competency is more correlated with their self-assessed capacity to carry out the essential services, but not so much. I mean, on the other hand, I mean, their capacity to handle workload is more correlated with their perceived shortage among the public health area. So it's kind of when they talk about their current capacity to carry out essential services, they seem to be think the current staff training, education, and competency is more important. But I mean, a great majority of local health departments report that they don't have enough staff to cover to handle their daily workload, and that's more reflected by this shortage index score. Did I answer your question?
Yeah. This is Dave Palm as well. I think that even though Nebraska is not does not have a highly diverse population, almost all of our local health departments would have a significant racial ethnic minority population in their area because of our meatpacking plants. On the other hand, there are not a lot of qualified people from those racial ethnic minorities that can be hired to address some of those issues. So I think it reflects a real shortage that we have at this time in Nebraska.
Fantastic. Thank you, David. Looking for any other questions. Anyone else that hasn't had a chance to put your question on the table? Fantastic. Well, thank you again to Li Wu and Dave Palm and our other colleagues in the Nebraska Public Health PBRN for some great work that's happening there in the network. You are forging ahead and helping us fill in these evidence gaps about understanding the public health workforce and its dynamics in the public health system. So, excellent work. And again, for those of you who may have colleagues who aren't able to be on the call today, we have recorded this session and we'll archive it up on the PBRN website so that others can access it later on, because this really is excellent excellent information. So with that, let me see here. I will we'll turn over to the administrative kind of component of our monthly call and switch over to that part of our agenda. And so the first item on our agenda, we want to spend a little bit of time talking about and kind of recapping on the most recent funding opportunity that the Robert Johnson Foundation has made available to the Public Health PBRN program and to our participating networks, and that is the multi-network research RFP that was released earlier this month. We did have a conference call. I guess it was just last week, wasn't it? Seems like ages ago. On the 7th of November, to kind of talk in a little bit more detail about that particular funding opportunity and what is being looked for and what we hope to get out of this opportunity. We recently, I think Ann Kelly from our group sent out just earlier today a list of kind of a list of Q&A questions and responses that came out of that call from last week. So that was emailed out to our primary contacts on each of the networks. We'll also get that posted on the website so that folks can have access to that. But we thought we'd also take a little bit of time as well today in the event that there might be some additional questions or ideas or comments that people want to put on the table with regard to the this multi-network research RFP that is out for public health PBRNs. So let me open it up and see if there are any questions that folks want to raise on that opportunity. Well, that's good. Maybe folks are pretty clear on the RFP and the major components there. We did also mention we had a great webinar yesterday for those of you who were able to join us hosted by Betty Beckmeyer and her colleagues in the, at the University of Washington and the Washington PBRN about the FAST study. It was a very nice update about kind of where things are with the FAST study, the Public Health Activities and Tracking Study, which is very synergistic with the goals of this new RFP to support multi-network research and to support additional work to measure practice variation in public health across multiple PBRNs. And so that webinar from yesterday hopefully will be was and will be helpful to networks in thinking about how this new RFP can help us move forward, help us move forward from a measurement perspective and collect some new and additional data on a prospective basis that can complement the data that is being collected and populated and analyzed through the FAST study, because we very much see this new funding opportunity as a way to move forward on the goals of FAST, which are building our collective capacity to analyze variation in public health practice and to learn from that variation. So again, this RFP will allow the networks that participate with us in this activity to actually receive some funding to do some prospective data collection, to collect some new measures, to go above and beyond the kind of the data that are close at hand and that have been captured already with through the FAST activities and the great work happening up in Washington. So thank you again, Betty, to you and your colleagues for doing that yesterday. That webinar is also, we were able to record it, and we'll have it up on the website for others who weren't able to be with us, who want to get up to speed on what's happening with FAST, and also to think about how it might relate to this new opportunity for new data and new analyses through the public health PBRNs.
And folks can feel free to let me know if they have questions too, or email me or what have you, if you have done that.
Fantastic. Anything else, Betty, that you want to say about FAST or about the interface with this new opportunity?
No, I think, thanks, Glenn, for helping make that webinar happen yesterday. It'll be, I welcome people's interest in what we've done already, how to leverage that work and this work going forward. Think in terms of these prospective data as being part of this larger data set that we're putting together. And you can, if you weren't on the webinar yesterday, you can listen to it and you'll get more of a sense of what's in that data set, and it's continuing to grow. And then those data would be data available to you and your PBRN as well, and data that we could all do other things with into the future.
Yeah, that's a very important point. These activities, what we're doing with these kind of activities, with FAST and now with this new funding opportunities, we're building a shared resource. We're building a shared data resource that can support hopefully multiple kinds of analyses research that might be of interest. Just looking at your individual network and the data and the practice variation maybe playing out just within your state, but also comparative research, comparing your state to other FAST states or other PBRN states, and looking at more cross-state and ultimately national dynamics and national patterns of variation with respect to how public health services are being delivered and how that varies across settings and what we can learn from that variation. So thanks again to Betty and her colleagues for doing that. Also, just to remember, as is the case with a lot of these funding opportunities with the foundation, it's a fairly constrained timeline in terms of responses. The application deadline for networks who want to apply to participate in this multi-network research opportunity need to get their proposals in by December 7th. And we are using the RWJ's, their online proposal submission and review system. So keep that deadline in mind. And as always, if we can be helpful, if you've got questions or problems or just even want to bounce ideas off of us, feel free to contact us at the Coordinating Center for that, and we're glad to talk with you already. I mean, we've already been getting, have heard from from several networks already about ideas and interests related to this opportunity. So keep your cards and letters and emails coming. We're glad to talk with you about this.
Glenn, this is Elaine from Connecticut PBRN. Is it appropriate to ask a question now about a study that could be related for our PBRN?
Yeah, sure.
Because I wasn't on unfortunately I couldn't participate in the FAST. I did see the notes you sent out, but one of the small studies that we're doing in Connecticut now will probably deal on ways that we could change the annual report, which is the way that local health departments, it's a mechanism for the state health departments to collect perform data from from local health departments. And we're realizing, some of the issues with that reporting system. So we're looking toward probably changing the annual report, working with the state health department in future. So this seems like it could connect to that goal, at least in some areas, some categorical areas, because you're looking to develop some standard measures.
Yes.
For public health activities across PBRN areas.
Yes.
Okay.
Absolutely.
So it's in the ballpark then.
It is, yeah. I think this, certainly for states that have any kind of a uniform data collection process that's capturing information about at the local level about public health activities, this study certainly could build on that, on the existing data systems that you have, and can certainly inform ways of improving those measurements and systems. And so, I had a talk and spoke with several colleagues in the Colorado PBRN yesterday about similar kind of dynamic opportunity in place with some data collection that's beginning there in Colorado as well. So, so absolutely, this opportunity could certainly help, help strengthen and leverage the kind of work that you're talking about doing in Connecticut, Elaine.
Glenn, this is Julie from Colorado, and I was on the same line, just wondering. I don't know if you have a sense of this, but the RFA one interpretation is that all the networks would be collecting the same data, but how much it could be kind of overlap, a lot of unique items across centers, or across networks rather.
Yeah, that's a great question. It is. We do envision that there'll be a core set of measures that we'll be able to identify in the first 6 months of this project. A core set of measures that each of the 6 participating networks would collect. But in addition to that, our expectation is also that networks would also be able individually to identify some additional measures that are of specific interest to your individual network. That you could also use this grant and these dollars to support collection of those additional measures as well, your kind of local PBRN measures. We certainly hope that this opportunity will allow for both those things to happen, to allow us to collect a core set of measures, in a consistent way across the network, so that we can support cross-network analyses, but then also that these resources hopefully will be sufficient for you to also support some measurement and data collection activities on items that are of interest, perhaps unique interest to your network. Is that?
Yes, and I guess the core, wouldn't be so large that it would
crowd out.
Right.
Yeah, I mean that's something that that like everything that we do in this program, this is going to be kind of a collaborative and process, and we're going to have to look carefully at issues of feasibility in terms of what goes into that core set, what's feasible, what can we feasibly measure, and what can we across the networks, what can we validly and reliably measure across the networks in terms of core measures. and that it'll probably be need to be a relatively small set of measures that make it into that core. And so the expectation is that certainly that would preserve some resources and time for you to also invest in some local measures as well.
Thank you.
Glenn, this is Paul Irwin. I have a question too about the latest call for proposals. The issue that you just raised of each PBRN within this multi-site network proposing unique measurement and data collection activities, or activities that are unique to their network, I'm having a little bit of trouble trying to figure out what that means as opposed to proposing unique research activities that might be developed in each of the specific networks. I don't know if that question is at all clear, but I'm...
Yeah. No, that's a great question. I think that is another feature of this RFP that we hope we're able to support. That we do want the intent is that this opportunity also provides the 6 networks that participate in this study an opportunity to use the data collected through this study, both the data that their own networks collect and also the data that are in this core set of measures that are collected by other networks to support analyses that are of interest to the network. And so certainly it's appropriate to approach this opportunity thinking that these grants, and these are modest-sized grants, so we got to be realistic in terms of what can be supported with a $50,000 grant. But certainly we hope that some of those resources can go towards supporting some analytic work that would happen within your individual PBRN that is related to to analyses, to questions that your network wants to answer that are that kind of unique interest in your network. And those analyses could make potentially could be teed up to make use of only the data that are being collected in your network, or those analyses could relate to doing comparative kinds of work that would compare perhaps your network's data to another network's data, or to all of the other 6 networks' data. And again, that local analytic work could also perhaps be positioned to focus, to prioritize and focus on these local measures that you're collecting uniquely in your network. So really, there are kind of 3 major components of this opportunity that we're trying to support here. We're trying to support collection of a common set of measures that will be collected across the 6 networks. We're also trying to support some local measurement activity that would be unique to your network. And we're also trying to support some local analytic work that would make use of the data being collected here.
The challenge I'm having with that is if I'm submitting a proposal, I really don't know what data collection instruments or data collection might be going on in the other places who are applying. Therefore, I'm unable to be able to identify up front what are the unique data collection activities that would lend themselves to a locally specific, analytic project here.
Yeah, no, absolutely. You can't, in terms of anticipating what kind of analyses you might conduct, based on the measures that will ultimately be selected and the other networks that will ultimately be selected. We've got no way of knowing that at this stage, and that's why we've built in a 6-month period to kind of support development and planning on that front. But hopefully you would be able to come to this funding opportunity with an idea of of the kinds of interests that your individual network might have with regard to measurement and analysis. And so that, to the extent that that you already know, some measurement interests that are resident in your network among its participants, or you already know some questions that would, from an analysis standpoint, that your network would like to pursue, at least locally, certainly you can, and we hope that you would describe those to the extent that they're known, describe those in your application so that we, have a sense of what some of the local measurement and local analytic interests are, coming into this project. Similar to kind of...
Hey, Glenn?
Yeah.
Glenn, this is Betty.
Yep.
And there might also, if provided we have the data and have organized it in time, there might be thinking about combining what their folks are collecting with what has already been compiled retrospectively and with this larger data set.
Absolutely, yeah, and that's spelled out, I think, pretty clearly in the RFP that we're, from an analysis standpoint, we want to be thinking about linking these new measures being collected, through prospectively with existing data sources, certainly with the existing data that are being captured through FAST, but as well, depending on the kinds of analyses that you want to pursue, linking them with other data sources that have, that can be linked together based on a geographic identifier. So that's absolutely the kind of work that we want to support.
Glenn, this is Julie. I guess what I was thinking with the last question before Betty was that often, at least with other funders, the application for a multi-site venture like this that hasn't yet been fully developed is part of what you're doing in the application is demonstrating kind of being able to go through that process and develop the questions and the analysis.
Right. Absolutely. Yeah, and that's why if you look at kind of what we're asking for in the proposal, we're looking at describing your capacity for doing this kind of work. We're looking for describing any existing interests that have been identified either on the measurement front or on the analysis front that would be relevant to this opportunity. We're not asking you to tee up and actually propose specific measures that would be collected here because we don't know that yet. There's an important coordination function that we'll have to put in place over the first 6 months to make that happen. But yeah, that's exactly right, Julie. So, yeah, so if you've got other questions of this nature, feel free to, to send them along in email or give us a call, and we're glad to entertain that. This is an exciting opportunity. We're testing. We're in some ways, taking the PBRN model to a new level and testing our collective capacity to do this kind of a process, to implement a standardized data collection protocol. This is something that we had envisioned that eventually the PBRN program and that public health PBRNs would be able to develop this kind of capacity for coordinated research using standardized kinds of measurement approaches. And we're going to give it a shot. We're going to test it out. This will be our first chance to do that, to really test standardized approach to prospective data collection and through the networks, and hopefully we'll learn a lot through this process, and it will make us all better for the experience. So, but again, yeah, feel free to let us know as you've got other questions or ideas or things that you may want to bounce off of us. We're glad to do that. Let's move on to our next agenda item. We want to spend a little bit of time talking about dissemination activities related to the great research that is now coming out of the public health PBRNs. And we've talked about these different kind of opportunities in other settings, but now as the program is maturing and as your networks are maturing, we're starting to see research projects produce findings, and really a large and growing number of projects are entering stages where you're producing findings and you're looking at opportunities for getting the word out on these findings And we want to be able to, to use as many mechanisms as possible and to really be as effective as we can in getting the great work that you've done out to decision makers who can make use of that information for improving public health. So we have teed up a couple of new dissemination mechanisms or channels that we wanted to make sure that you all are aware of, and we wanted to talk through a few of these new opportunities. Obviously, our publications and using peer-reviewed journal articles are continue to be a very important mechanism for us, and we're going to continue to tee up opportunities for publishing the work of public health PBRNs and peer-reviewed journals. We've got an opportunity that we're in the midst of now of that's playing out in terms of a theme issue in the American Journal of Preventive Medicine that is moving forward based on a set of papers that several of our networks have submitted into us for the theme issue of AJPM devoted to public health PBRN work. So that opportunity is moving forward, and we'll be in touch with those of you who have submitted papers for that opportunity shortly about next steps. We've sent the collection of papers in for an initial review at AJPM, and we're getting feedback from them and having you submit those officially into the journal shortly to go through their peer review process. So that theme issue is already off and running down the track. We have another special journal publication opportunity that we mentioned for the first time last week in the newsletter that I want to, again, make sure everybody's aware of at this forum. And this is a special issue of the Journal of Public Health Management and Practice that many of you are familiar with. Much more of a practice-oriented journal. It is a peer-reviewed journal published by Lippincott. Has become the official journal of the National Association of County and City Health Officials. It really reaches a wide audience of public health practitioners and of practice-based researchers. The editors of that journal, Lloyd Novick and his colleagues, have asked us to be guest editors of a special issue devoted to advances in public health services and systems research. This will be this will be the November 2012 issue of the journal, which is kind of nice because it means it will come out in time to be marketed in conjunction with next year's American Public Health Association annual meeting. So it'll be kind of a featured journal release event, issue release event at that meeting next year. So if you're interested in being a part of that journal, that special issue, you might want to put this on your radar. If you've got a paper or some findings that are coming out that might be appropriate for a journal in that, or a paper in that journal, this is one to look for. We will need submissions for that journal by May 1st, not May 1st, by March 1st of 2012. So if you want to be a part of that special issue, you need to have a journal that is a paper that is submission ready by March 1st of 2012. We'll send everybody out more information about this opportunity and about the details. But I wanted to go ahead and let you know about that. This is an opportunity we firmed up with the journal. It's definitely a go, and March 1 will be the deadline for submissions. So stay tuned for more information, but you might want to go ahead and file that in your calendar in terms of another publication opportunity. Beyond journal publications, we also have teed up a couple of other dissemination channels for getting the word out. One important channel is a series of new newsletters that the U.S. Centers for Disease Control and Prevention have developed for this very purpose, for getting out information to public health practice colleagues across the country. It's a series of two monthly electronic newsletters that come out of the CDC. that come out of the Ostilt's office, Judy Monroe's office at CDC. Again, the target audience is largely state and local public health professionals, public health practice colleagues. One newsletter is called Did You Know? CDC's Did You Know? And the other newsletter is called CDC's Have You Heard? I have to admit I don't know the exact distinction between these two newsletters. I know they have slightly different kind of content orientation. But CDC and our partners at CDC and Judy Monroe and her colleagues have asked us to, at the PBRN Coordinating Center, to play an ongoing role in helping them to feature new research and new research findings in those newsletters. And so we're going to be. Oh, thank you. Actually, Ann Kelly is telling me one of those newsletters that is oriented more toward the general public. They're targeting the general public with news and events and new information about public health. The other newsletter is targeted specifically at public health professionals. So that's why there are two newsletters. Thank you, Ann. So we're going to be helping CDC develop content, specifically content that's coming out of your research of the PBRNs, and helping to package that for dissemination through these two new CDC vehicles. So what that means is we're asking you to let us know as you have emerging findings that are coming out of your research that you think would be appropriate for dissemination through these new CDC vehicles. Let us know, and we can help you package that and help get that content into these newsletters. We think this will be another very useful vehicle for getting research-based evidence and information out into the hands of decision makers who can use it. A third dissemination activity I wanted to share with you is a new podcast series that we're going to be developing through the Public Health PBRN program. Again, using a slightly different channel of communication for getting the research of the Public Health PBRNs out to decision makers using the podcast. This idea actually came to us from one of the members of our National Advisory Committee, Dr. Paul Halverson, who is known to many of you. He is the state health director for Arkansas, and also the immediate past president of ASTO, the Association of State and Territorial Health Officials. And this idea, he came at this idea recognizing that, particularly in thinking about getting information into the hands of state public health officials, a lot of his colleagues at the state level are not reading journals. Don't even have the time to read our newsletters. But a short, brief podcast is something that he feels would be is potentially a good vehicle for getting practice implications and practice relevant findings out into this segment of our audience. So Dr. Halverson has volunteered to actually conduct these podcasts, and the thought is that, again, as you and the PBRNs have a research project that is bearing fruit in terms of findings and practice implications, like the findings that we just heard from Lee Wu and his colleagues in Nebraska, what we would do is schedule a time for Halverson to interview you or your research team and record that interview as a podcast that can be then disseminated through a variety of channels, both here at our center at Kentucky and also through ASTO and their channels in particular, because of Paul's connection and ongoing role at ASTO. So this would be basically an interview. You'd be interviewed by a sitting state health official. He'd ask this would be a brief interview, probably a 3 to 4 minute interview, really focusing in on practice implications, what your research can offer in terms of guidance to public health decision makers, practice and policy decision makers. And if you know Paul Halverson, he can be quite incisive in his questions and discussions. So we want to identify some projects and some PBRN research projects that might be ready for this kind of a dialogue with Halverson it'll be easy. You can do it from your desk. We've got the software and the equipment to make this very easy to record. It'd be just an audio podcast recording. We get a photo of you and a photo of Halverson to package together. We can disseminate it through the channels that we have here. We've got iTunes accounts and others, and we also can disseminate it through the RWJ channels and through the ASTO channels in terms of getting the word out on your great research. Okay, lastly, there's one other dissemination channel I wanted to let you know about. This is, again, another new channel that we're developing with the Robert Wood Johnson Foundation. And that is a new publication, a new periodical that we're going to be developing called Frontiers in Public Health Services and Systems Research. And the idea here is to create a short monthly publication that will highlight really research in progress and early findings from research projects that are coming out in the PHSSR arena. So certainly this would include studies that are being conducted through public health PBRNs, but we wouldn't limit it to that. We're going to be reaching out to the variety of places that are and people who are conducting PHSSR, and the thought is to feature short descriptions, very much in the spirit of the MMWR journal that is produced weekly by CDC. That's designed to produce, to publish preliminary findings, highlights of emerging research, and to really focus again on the practice and policy implications of that research. This new Frontiers in PHSSR publication will be designed to capture and disseminate that information. In very much the same way that MMWR is designed to capture largely early findings from epidemiologic research and surveillance, and to get that information out quickly in advance of the full-scale peer-reviewed publication, and many times quickly out to decision makers who can use that information. We have a partner in the American Journal of Preventive Medicine. AJPM has agreed to partner with us in the development and production and dissemination of this new Frontiers in PHSSR monthly publication. And very much we're structuring that relationship, modeling it after the relationship that MMWR has to JAMA, the Journal of the American Medical Association. As many of you know, the weekly JAMA features a page of highlights of research that is featured in the MMWR publication, so that JAMA works to kind of augment and amplify the dissemination that occurs through research that's featured in MMWR. Similarly, we're going to have that same relationship built into the journal, the American Journal of Preventive Medicine. So HAPM every month will feature a page on a research that is highlighted in this new Frontiers in PHSSR publication. It's largely going to, the Frontiers will largely be a web-based publication. Again, AJPM is going to be working with us to develop that platform, and also to develop the interface with the American Journal of Preventive Medicine with that standard monthly publication. So another great vehicle that we'll be developing for disseminating your research, and we'll be again looking for you to let us know as you've got findings that are coming out of your projects ready to be featured in these kind of dissemination opportunities and channels. Let us know. Shoot us a quick note to the Public Health PBRN email account. We can help you, link you up with the right channels that are going to work for you, and help tee up these opportunities for you. So we'll be providing more information about all these channels as they're rolling out, featuring them in the newsletter, et cetera. But we want to spend some time today letting you know in particular about these 4 new dissemination channels, so that you can begin thinking about them as you've got studies that are completing and that you're looking at ways of getting the word out. These can hopefully be of help to you, because again, that's a key part of what we're trying to achieve with this larger PBRN program, is reducing that cycle time between discoveries from research and getting those discoveries out into the hands of decision makers who can use them to improve practice and improve policy. So we hope that that we're moving forward on that goal of the program with some of these new dissemination channels. Any quick questions on that? All of that?
Glenn, yeah, this is Elaine, Connecticut. I think these are great opportunities, all of them, and I'm particularly pleased to hear about the Frontiers publication idea, to have opportunities to get out information about research in progress. As you know, we tried to submit, for instance, to the journal, the Preventive Medicine Journal, and couldn't get the data in time to do it. So we'll make the next one hopefully. But
absolutely.
It's nice to have an opportunity to be publishing before you have completed the work, just to let people know what you're doing. But I'm wondering, I really like the feeder idea. You're saying that these briefs would go to the Journal of Preventive Medicine.
Right.
And I'm wondering, and I think that's good, but I think also other journals that perhaps, are more read by the public health practice community, can it go, will these go to other places as well? Like, I was really excited about the journal, the special issue in the Public Health Practice Journal that's coming out.
Yeah, absolutely. We're going to be looking at building as many linkages as we can to these vehicles, and certainly the Journal of Public Health Management and Practice, because we know it does have that probably the highest penetration of any of the peer-reviewed journals into local and state public health practice. We definitely want to capitalize on relationships with that journal as well. So we're going to be looking at ways of getting these kind of emerging research findings into that journal as well on a rapid basis. The reason for tying Frontiers into AJPM, a couple of reasons. One is they have some experience already with particularly with these kind of web-based dissemination channels, and they're looking to really grow out their web presence of the journal. And they also already are the home for regularly publishing, for example, the new entries into the community guide, the CDC's guide to community preventive services. So it's already kind of a home for publishing those regular updates and evidence reviews. And so this provides us kind of with a way of tying in some of the PHSSR and PBRN work into that vehicle. But you're right, we can't stop with just a single journal like that, which is still largely reaching an academic and research audience. So,
we want to do both. I didn't mean to say we couldn't do that. I just think if it could be expanded, that would be great.
Absolutely. Yeah. We're also continuing our partnership with NATO in terms of feeding research summaries into NACCHO's regular newsletter and their periodic NATO dispatch publication. So, we've got that channel that we're continuing to support as well. So we can help you get features into the NACCHO newsletter, into the NACCHO dispatch, quarterly dispatch publication as well.
Okay.
Great comments. Thank you, Elaine. Let me move us along. I know that we're always running tight on time here, but if you've got other thoughts and questions, comments about these, please feel free to shoot us a quick email. I wanted to quickly mention, just in terms of this particular forum, this monthly web-based conference call that we do. As you all remember, it was at the beginning of this year that we moved to this new format of spending our first 30 to 40 minutes on a research presentation from one of our networks, and I personally think this has worked really well. It certainly helped us to get a much better handle on the research progress that's happening in each of the individual networks. We have rotated through I think a full cycle of our networks as of December. As of next month, we will have finished a full cycle of rotating through at least our 12 core networks, I believe. So we're going to be looking beginning in January for networks to kind of sign up for a month in assuming responsibility for one of our monthly virtual meetings and presenting some research from your network at that monthly meeting. So if you've got a particular month that you want to claim starting in January for the 2012 year, please let us know. You can shoot us an email. Otherwise, I think what we'll do is go ahead and make some assignments and contact you to see if those assignments will work in terms of a month that you'll assume responsibility for. We will be working in our affiliate networks into that schedule as well. I don't think we haven't yet had the affiliates, Georgia, Missouri, and others, have a turn in terms of this. So we'll be looking at hearing from the affiliate networks, and then we also want to rotate back through some of our primary networks as well over the 2012 year. So let us know if there's a particular month that you'd like to claim. Otherwise, we'll begin to slot you into schedules to months for the upcoming 2012 year. So we wanted to put that on your radar. And then finally, in terms of brief items, some of you in the PBRNs have some RWJ reporting deadlines that are coming up, and we just wanted to remind you of that. You know, there are with the foundation for the foundation grant that you have, there are annual narrative and financial reports that need to go in, and then also if you're completing a grant, completing an entire grant cycle, there's a final narrative and final financial report that needs to be submitted to the foundation. So, for example, I think with our second cohort of primary PBRNs, your base grant from the foundation, the 2-year base grant, for most of you is winding up at the end of this month, the end of November. So you'll have a final narrative and a final financial report that would be due typically 30 days after the completion of your grant. So just make sure to have that on your horizon. RWJ has guidance on how to complete your final reports, how to complete your narrative reports. If you've got questions on any of that, again, we're here to support you, and so feel free to contact us if you need some help with how to approach your reporting to the foundation. And as always, we also request that you, when you send your annual or final reports to the foundation, that you also at the same time send them to us at the coordinating center as well, so that we have your reports on record. So again, our second cohort of PBRNs, you are likely to have your final reports for your base grant coming up. Networks who have the first cohort of networks who have the research implementation awards, I think your projects you'll be approaching a reporting activity as well in the coming months. So keep those on the radar in terms of reporting deadlines. For quick strike research projects, those are projects that we fund directly from the network. They're money that we pass through from the network to you. So you don't have a reporting obligation directly to the foundation, but we do like to hear, as your quick strike projects are finishing up, obviously we like to receive the products from your research as your final report for your quick strike. So if it's a journal article, if it's a policy brief, et cetera, the products that you identified that were going to be products produced by your quick strike research project, that's what we want to receive as your final report from quick strike research projects. So as those are wrapping up, make sure to send us your products. You can email those right into the Public Health PBRN email account. And again, we're always glad to help if we can help you in finalizing those products, or you need some advice on targeting or positioning. We're glad to help with that. Okay.
Related question.
Yeah, go right ahead.
Glenn.
Sure.
This is Bill, Living Good. On press releases, they're supposed to be approved by RWJ. Should we submit those to you and you forward them to RWJ?
Great question. Yeah, anytime you're doing a press release, the RWJ Public Affairs Office likes to be contacted in advance. They've got great talent. They can help you refine that press release. They can even help with the actual dissemination in some cases and expand your reach. You can feel free to go directly, to directly contact the foundation when you've got press release plans. We'd love to be included in the loop and love to be, you copy us with your press releases at a minimum, just so we know what you're doing and so that we can also help to the extent that we can get the word out. If you would like our assistance in helping to craft your press releases, you're welcome to contact us in advance as well. If you want us to review something before you send it on to the foundation, we're glad to do that. And we've got some good PR people here with us at the center, and also at the larger PHSSR coordinating center here at Kentucky that can help with that. So you don't have to contact us in advance. You can go right to the foundation if you're ready to do that. But if you want our input in advance, we're glad to do that. Thanks for that question, Bill. So we're wrapping up. We just got a couple of minutes left. A few other just quick reminders. It's not too early to start planning for the Keeneland Conference and for our Public Health PBRN meeting that will be held in conjunction with the Keeneland Conference in April. We did want to let you know the call for abstracts for the Keeneland Conference will be released in early December. So we're coming up on the time for call for abstracts. The deadline for electronic submission of call for abstracts for the main Keeneland Conference meeting will be, as far as we can tell, that will be January 9th. So we wanted to go ahead and get that on give you a quick heads up on that. You'll be getting emails about this shortly, but we just got word about that deadline, so we wanted to pass it on to you. And then finally, we want to let you know there's going to be another special funding opportunity passed out to the public health PBRNs and shortly, and so be on the lookout for this. This will be funding opportunity to support. These will be mini grants made available to the public health PBRNs to support mentored dissertation or mentored junior faculty awards for either pre-doctoral or postdoctoral researchers who are working or who are interested in working with your public health PBRN. These are going to be focused specifically on engaging underrepresented people from underrepresented backgrounds into research work that can be done in partnership with your public health PBRN. So very similar to the supplement that was made available earlier in the year, the supplement for expanding diversity in your public health PBRN team. So these are going to be mini grants that you'll be able to apply for. These are going to be smaller awards. They're kind of dissertation size awards that you'll be able to apply for. If you know of a pre-doctoral or postdoctoral junior faculty kind of person from an underrepresented background who's interested in doing some research in conjunction with your public health PBRN, we're going to have a funding opportunity for you shortly on this. So we'll be sending out more information via email, but we wanted to go ahead and let you know, since we've just gotten authorization to pull the trigger on this, that this will be coming to you shortly. With that, I think we are just about out of time. If there's a pressing question or two, we'll pause for that. And hearing none, thank you all again for your time and for being with us on this call. Thanks again to our colleagues in the Nebraska Public Health PBRN for their research presentation. That'll be archived on the website here shortly. Contact us if we can help with anything. You all are doing great work. So hang in there, and we'll talk to you soon. Thanks so much.
Thank you.
Thanks.
Happy Thanksgiving.
Bye.